Okay, so today we're doing a deep dive into something pretty important, mental health in the Black community in the U.S. And we're going off of this text here that I found really fascinating.
Interesting.
And there's this statistic right at the beginning that kind of blew my mind, and it said that Black individuals,
Oh, wow.
they may be less likely to seek help for depression than their white counterparts.
Really?
Yeah. And so I thought, why is that? You know?
That's a good question. Well, this text, the first thing it kind of jumps into is this heavy stigma that surrounds mental illness in the Black community.
Yeah.
And it's like this invisible wall that's preventing people from getting help. And the research shows that the stigma is linked to, higher rates of untreated mental illness.
So it's not just people feeling a little weird about talking about it.
Right.
It's actually having real world consequences.
Exactly.
Yeah. So, what makes this stigma so powerful?
Well, I don't know if it's necessarily unique to the Black community.
Okay.
But it's definitely amplified by the historical and cultural context of, what it means to be Black in America. And so, centuries of just systemic racism and discrimination, it's created this environment where vulnerability can be totally misconstrued. And, in a lot of ways, seeking help, it's almost seen as a sign of weakness and almost a betrayal of the resilience that's been essential for survival.
So that really puts this this mistrust of the healthcare system that the text talks about in a whole new light.
Right.
It's not just individual experiences, it's this collective memory of injustice.
Exactly.
So, but what events or practices have kind of led to this feeling of mistrust?
Well, there's a lot.
Yeah.
But I think one that really stands out is the Tuskegee syphilis study.
Oh, yeah.
Where, Black men were denied treatment.
For syphilis.
Yes, for syphilis.
Even after there was a cure.
Exactly.
Yeah.
And so just imagine the generational trauma that comes from that complete disregard for human life. And then you couple that with ongoing disparities in healthcare access and treatment quality. And it's no wonder that this mistrust exists.
It's heartbreaking.
It is.
It's absolutely heartbreaking. And so the text also mentioned that Black people are 20% more likely to experience things like depression and anxiety.
It's true.
And even higher rates of PTSD.
Right.
Especially
for
emerging adults and older adults.
Yeah.
What contributes to that?
Right. Well, you have to think about the trauma that a lot of Black people face, especially exposure to police violence, and the psychological burden of that, the fear, the hypervigilance, just the constant feeling of being unsafe. And that kind of chronic stress takes a serious toll.
And then there's intergenerational trauma to think about too.
Exactly.
So it's like this perfect storm brewing, higher stigma, deep-seated mistrust, and then a higher prevalence of mental health challenges.
Yeah.
But then this text goes on to talk about the systemic barriers to accessing care, lower rates of health insurance, limited access to Black mental health professionals.
Yeah, absolutely.
And then implicit bias within the healthcare system itself.
Totally, yeah. And it's, it's a situation where even if someone overcomes that stigma and actually seeks help, they run into all these obstacles, like finding a therapist who, understands your background and your experience can feel impossible when there aren't enough Black mental health professionals. And then you add in implicit bias where your symptoms are downplayed or misdiagnosed because of these unconscious prejudices.
It's overwhelming.
It is.
I thought it was really interesting reading about how certain cultural factors can impact mental health in the Black community.
Yeah.
Like this pressure to be strong and to handle everything internally.
Right. Because there are these cultural values that, emphasize strength and perseverance, which are super valuable in the face of adversity.
Right.
But those same values can make it hard to talk about mental health.
Bezlet, it's a double-edged sword.
Yeah, because then there's this pressure to keep your struggles private, and you feel shame or embarrassment for needing help.
But the text did offer a glimmer of hope, I guess, talking about resources specifically designed to support mental health in the Black community.
Absolutely. And it's so important for people to know that these resources are out there.
Yeah.
There's some incredible organizations doing really amazing work. Places like local community health clinics often offer affordable or sliding scale services.
Okay.
You can also call the National Treatment Referral Helpline.
Oh, okay.
And they can connect you to services in your area.
That's great.
And then there are groups like BEAM, the Black Emotional and Mental Health Collective that provide training, resources, and, a supportive community specifically for Black individuals.
Well, I mean, this has been a really eye-opening deep dive.
It has.
It's one thing to acknowledge these issues, but we need to move beyond that.
And
start actually dismantling this stigma surrounding mental health.
I agree. I think we need to challenge those old narratives that say vulnerability is weakness.
Right.
Seeking help is not failing. It's courage, it's self-care.
You've given us so much to think about. I mean, as we wrap up here, I want to leave everyone listening with this question. What role can each of us play, both individually and collectively, to create a world where mental health is talked about openly?
Yes.
Where seeking help is celebrated as a sign of strength?
Right.
And support is available for everyone, regardless of background.
That's the goal.
Keep learning, keep these conversations going.
Yes.
And let's work together to make things better.
Absolutely.
Thanks for listening, everybody.
Yeah, thanks.
And we'll see you next time.
See you next time.